spine. It plays a crucial role in supporting our head and facilitating movements, such as when you're looking around or when you're turning over your shoulder when you're driving your car. Um, a lot of things, right? So, however, neck pain can give rise to many other issues. And now, if you're an executive mom and you're juggling your home life, work life, you understand that neck pain can stop you in your tracks. Now, on top of that, if you have other implications of neck pain, that can cause a lot of lot of disruption to your daily routine, right? So neck pain can lead to many other things, but one of them and the major ones is dizziness. Now, this is known as a cervicogenic dizziness or a cervical vertigo as well. I will explain to you in the video why and how this happens. So, before we get into the topic for today, which is neck pain and dizziness and understanding the connection between them, let me introduce myself for those of you who don't know me. My name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs to manage their spinal, that is back and neck, and nerve pain. I do this by giving you simple exercises, some lifestyle modifications, and some tips and tricks that have helped me in my own pain journey. And I do all of this without taking away a big chunk of your time because, hey, we're moms, we're busy people, right? So, without taking more of your time, let's get into the topic for today, which is neck pain and vertigo and understanding the connection between these two. If you see me looking away from my screen, that's only because I'm looking at my notes here. Now, our neck or our cervical spine, it is made up of seven vertebrae, and there are vertebrae that are stacked on top of each other, and between every two vertebrae, there are nerves that exit the cervical spine, actually throughout the spine, but right now we're focusing on the cervical spine on the neck or the neck. So, between every two vertebrae on either side of the spine, you have nerves that exit the cervical spine, and these nerves that exit the spine go and supply specific areas of your body. So, for example, the ones that exit the mid to the lower part of your cervical spine, so about the middle of the neck here to where your neck joins the shoulder here, this part will go and supply your shoulder, arms, forearms, fingers. So, if you're one of those who get tingling, numbness, or nerve pain or burning sensation in these areas, you can safely assume that it is, if it is a nerve pain, then you can assume that it might possibly be coming from your mid to lower cervical spine. Now, if you have the nerves, you also have nerves that are exiting the upper to mid cervical spine, that is from your hairline to the middle of your neck here on either side. So these nerves, they go up the back of the head, come to the side, and this is the area of supply for these nerves. So when these nerves get irritated or compressed, or basically there is some kind of pressure on these nerves, they will lead to many symptoms, such as lightheadedness, headaches, nausea, and dizziness. Now, that is why the dizziness that originates in your neck or your cervical spine is known as a cervicogenic dizziness or cervical vertigo, because this dizziness can be quite similar to the vertigo that you typically get when you have problems with your inner ear. Now, inside your ear, you have something called a vestibular apparatus. If you can't remember that, just remember deep inside your ears on both sides, there are some small structures present. And if there's a disturbance in that area, then it can lead to vertigo. However, we are not talking about vertigo or BPPV or Meniere's disease or other causes of dizziness. We are talking about dizziness that originates in the neck. So, this is the basic connection between your neck pain and your dizziness. Actually, between your neck and your dizziness. Now, what about the neck pain part of it? Now, why will these nerves get irritated or compressed? If, say, you have a disc bulge, and the disc is actually pressing on these nerves, it is not in its usual position, but it's bulging out, or it is a herniated disc, and these discs lead to compression or irritation of the nerves. Or if you have a stenosis or even trauma or even muscle spasm due to any reason, which is so severe that it irritates the nerves, it will lead to these symptoms, one of which is cervicogenic dizziness or cervical vertigo. Now, let's talk a little bit more about the symptoms of dizziness that originates in the neck, because you might have dizziness and you're wondering, like, is my neck giving rise to this dizziness? Is it because of my ears? And of course, you can go to the doctor and have it checked, and which you should. However, there are some times when just before your doctor's appointment, say your doctor's appointment's a few days down the line you're wondering why are you getting this dizziness. So let's talk a little bit about what the signs or symptoms of this kind of dizziness. So the very first thing is neck pain. It is not necessary that this dizziness comes with the neck pain all the time, but most of the times you will have some problem or pre-existing condition in your neck. Say you have degeneration or arthritis or cervical spondylosis in your neck, and that can cause this dizziness. Now, another thing that is very common that happens with these dizziness is visual disturbances. So this could be rapid eye movement. So if you're focusing on one place, you're not able, suppose I'm looking at my fingertip here, I'm not able to focus on the fingertip, but my eye is moving rapidly. Now you may not realize it because obviously you can't look at your own eyes unless you're doing this in front of a mirror. However, you would see when you're reading that your words are floating. That is one of the very typical symptoms or signs that will tell you that you have the rapid eye movement, or you're not able to focus very well. Right. So another thing that happens is the cervicogenic headaches, as I had mentioned earlier on. So headaches, again, typically will originate in the neck, but sometimes they can also just be the back of the head and the side of the head. And depending on whether the nerve in your left, or I mean the left or the right side is being irritated, you will have headache on that side. Cervicogenic headaches can also go into the socket of your eye and into your TMJ or the jaw joint. It can go into the temple areas and behind the eye as well. It is a little different from migraines because migraines tend to be more like more in the middle of the head or two-sided, and tension headaches tend to be more around your forehead. So you don't have the typical distribution of the headache coming in from the back of the head to the side of the head. So this is another feature that can be present, which is cervicogenic headaches. Just looking at my notes here, um, yeah, so you might feel a little off balance as well when you have this dizziness, which happens with other problems, as I mean other forms of dizziness as well, coming from your ears or another areas of your body, or your brain for that matter. But when that the dizziness, feeling off balance, is accompanied by visual disturbances, accompanied by cervicogenic dizziness, accompanied by neck pain, then you can put two and two together and think that it's possibly your neck that is causing your cervicogenic dizziness. Now, if you're still unsure about if your neck is the cause of your cervicogenic dizziness, I have written a free guide, and that tells you point by point. It takes you through these it takes you through these points, and it sort of indicates whether your neck is responsible for your dizziness. Now, if you want that guide, you can have a look at the blog that I have written on the same topic. If you're watching me on Instagram, the link to the blog will be in my bio. If you're watching anytime in the future and you can't find the blog, just message me and I will send it across to you. This blog also has some more information on cervicogenic dizziness, and yeah, so it's got information that will be useful if you have dizziness or you're wondering if it's coming from your neck. So have a look at that. Now, if you have any questions, any comments for me, please let me know and I'll address them for you. If you're looking for even more information in addition to that blog, you can go to my YouTube channel, and I have done a couple of videos on cervicogenic dizziness and neck pain, and also cervicogenic headaches. You can go to YouTube, just type my name. If you can't find my channel, you can just say Swati Prakash Dizziness, and those videos will come up for you. Sorry. Alrighty. I'll see you guys next time. If you have any questions, do drop them below and I'll address them for you. All right. See